following episode is brought to you by the American Urological Association. This special episode is all about the Sexual Medicine Society of North America's meeting at the 2025 annual meeting. Keep listening to hear about the agenda and the main clinical areas being highlighted from Dr. Landon Trost, President-elect of the Sexual Medicine Society of North America.
Hi, my name is Jay Rahman, and I'm Professor of Urology at Penn State Health and Chair of the AUA's Office of Education. It's my pleasure to host another episode in our educational podcast series, and this is one of several episodes where we will be focusing on some of our annual meeting content for AUA 2025. Specifically, today's topic is going to be the Sexual Medicine Society of North America meeting at AUA 2025. And it's really our pleasure to host Dr. Landon Trost, who's president-elect of the SMSNA. Dr. Trost is going to talk to us a little bit about the society itself, as well as what we can expect from the AUA 2025 SMSNA meeting. Dr. Trost is a urologist and he's affiliate faculty at the Brigham Young University. He specializes in multiple different domains of men's health, including vasectomy reversal, Peyronie's disease, and male infertility. He is now in practice in Utah, having previously served as chief of andrology at the Mayo Clinic in Rochester, Minnesota. He is editor-in-chief for the Journal of Sexual Medicine and has served on 3 AUA guidelines panels. So he's obviously well-published, well-known, and really a thought leader in the field. Landon, it's our pleasure to have you here in your capacity as a member of the leadership of the SMSNA. And really, thanks so much for taking some time to sort of share with us what we're going to expect to see at the annual meeting and maybe even beyond that for those that are really interested in this space, what they can look forward to.
Well, thanks. Yeah, my pleasure. Thanks for having me, Jay.
So maybe before we even talk about the SMSNA meeting, maybe talk to us a little bit about, what is the Sexual Medicine Society of North America? Maybe what are the persons that sort of comprise being part of this organization? And then, what is its focus and what is its maybe, relevance and what does it bring to sort of the broader field of urology? Just give us that 20,000 foot view to start.
Yeah, sure. Well, so the SMSNA is arguably the largest and most reputable group of clinicians dedicated to sexual medicine. It's mostly made of urologists, but there are also psychologists and others that make up the group, PhDs, basic scientists. As you know, sexual medicine is just full of scams and half-truths and false claims, and I would say arguably more than any other field, within urology. So there's an absolute need and importance for a group like the SMSNA, and their contributions become invaluable. It's a group that's not afraid to speak out against inappropriate practices or to address controversy. They put out multiple position statements, including on controversial topics like restorative therapies and cosmetic procedure type things. So it's a wonderful academic group in an area of medicine where it's needed.
So maybe, as persons sort of think about getting better exposure to SMSNA, I think there's really several different avenues. Obviously, there's those that have gone through specialized training and obviously probably have sort of grown up knowing about this society. And then there are those that maybe they don't know as much, but they're really interested in the content. They maybe have a practice in that disease space. And it seems to me that one of the easiest opportunities to maybe toe the water, to sort of learn a little more about it, to maybe get more involved is at the AUA meeting, where many people are attending anyway, just for their annual medical education. So talk to us a little bit about, first of all, let's start with, when is the SMSNA meeting at the AUA 2025?
Yeah, so it'll be on April 26th, and it's held from 8 to 3 this year in the Palazzo J location at the Venetian. So it's all in one kind of compact time. It will have an hour lunch break, but otherwise it'll go straight through.
Got it. So it's really it's essentially almost a full day meeting. When you look at it, I mean, other than that hour for lunch, you're really looking at almost the entire morning and the majority of the afternoon. Maybe talk to us a little bit about what sort of topics are going to be covered there. I realize you may not be able to tell us every single one, but maybe just walk us through what is covered, maybe some of the stuff that is new, maybe some of the stuff that is debating or talking about existing practices. Just walk us through some of that.
Yeah, of course. Well, so we tried to make it a diverse enough program to where you could come there and get something for everyone, essentially. So we basically have at least one lecture on every major topic within sexual medicine. And we have a lecture that's meant to be very clinically oriented. So we'll have something like the top 5 things every urologist should know about female sexual dysfunction. We know everyone's not going to be a female sexual function specialist, but you want to know a couple of key things. We have something on like supraphysiologic testosterone therapy. That's a real hot topic right now. We'll have a visual atlas of key penile dermatology findings. So again, these are things that could appeal to the general urologist as well as to the specialist. We have certain things on like deceptive and dangerous practices within the supplement industry, BPH therapies that have the fewest sexual side effects, new collagenase injection techniques, and then like the most clinically relevant psychological literature. We also have kind of higher level things where we're going to talk about some new position statements that are going to be released by the SMSNA, specifically with restorative therapies and how to interpret the gold standard measures for erectile dysfunction. So it should be a very high yield meeting that's meant to appeal to kind of all audiences. So.
Yeah, I think that's really super. And I think the way you phrased it is so great, which is as somebody who doesn't do a lot in this space, you've hit on a lot of topics that I think would be relevant and interesting to even maybe those of us that are not wholly immersed in this sort of realm of sexual medicine. But then obviously you have some content which takes that deeper dive. So I do really think it sort of caters to a very broad audience overall. Talk a little bit about, are these mostly, is the format sort of state-of-the-art lectures? Is it panels? Is it point counterpoint? Maybe talk a little bit about the structure of how you're delivering this content.
Well, we try to keep it kind of fresh and interesting. So most of the lectures are just 15 minutes. So it's very, bullet points, take home messages, just high yield. We want this to be, just like a high summary of things. But then the whole afternoon is dedicated to the surgical side of things. So those are going to be panelists with audience discussion, polling, things like that. So very back and forth for those 3 hours, just kind of going through for the 2 hours they're going through, troubling or when someone has complications, how do you manage it? How do you manage the troubling, difficult patient, things like that. And then in the morning, we also have some audience back and forth of what are you doing in your actual practice? So there'll be live audience polling of who does this, who does that. And then some back and forth discussion with the panelists as well. So I think it should be an engaging and enjoyable. There are a couple things that are, top 3 publications in this area. There's a couple society position statements, both from the ISSM as well as SMSNA. So it should have a pretty good variety overall.
Talk a little bit about, the AUA always has so much stuff going on at it. And obviously, when you have a full day meeting, there may be other competing activities. So there may be persons who can come to the entire meeting, maybe some that can only come to parts of the meeting. And some may say, wow, this is really fabulous content, but I have some other conflict going on at the same time. And so this is kind of my way of asking you, for those that are interested in this, take us a step back outside of just the AUA meeting itself and tell us a little bit about when is maybe the other, I'm sure there's a freestanding SMSNA meeting. Talk a little bit about that, or maybe other ways that people can maybe consume some of this education that you're providing outside of the annual meeting itself.
So I think there's a couple ways you could. First, we have our SMSNA standalone meeting generally every fall. And this year it's going to be held in Texas, and the dates are going to be October 9th through 12th. So that's a bigger, deeper dive type meeting. So certainly there's content available there. We're also working on recording all of these lectures and content and making it available via SMSNA's YouTube channel. So that should be available. SMSNA is also starting a podcast and has webinars and other things that are available. They have an online university. So there's certainly a broad set of offerings. Probably the easiest way to find all of that is just to go to smsna.org, and that'll have a listing of all of the different resources that are available, upcoming meetings, things like that. So,
yeah, I think, it's interesting. One of the things I've learned in my current role over the last few years is the video content is so valuable because there are many people who can't maybe make it to a specific session, but are really interested in. And the fact that a lot of this content is videoed or audio really allows for, consumption without necessarily physically being there at one time. And I think, as you mentioned, this concept of podcasts, we're always multitasking, driving from place to place, exercising, doing other things. And I think these podcasts are a great way to sort of listen and maybe absorb some of the material at a higher level just while you're doing other activities. What's new in the horizon? Give us some things that, as somebody who's immersed in the field, and maybe it's covered at the AUA 2025 SMSNA meeting, maybe it's not, but kind of what's new out there, what's controversial, and I realize I'm sort of putting you on the spot, but give us your impression of new controversial things that you think are exciting and will sort of be important considerations over the next few years.
Well, I think, sexual medicine is definitely at a golden age as far as that's concerned, as far as innovations and things developing there. Really, probably the most exciting time since kind of the Viagra kickstarted most of the men's sexual health type things. And it's the whole field. So from a XIAFLEX standpoint, there's new techniques and innovations, and we're going to be highlighting some of those new kind of secondary confirmations of the changes there. There's a bunch of new medical devices coming out for the first time. There's new medical devices related to premature ejaculation. There's new diagnostics out there. There's a new Peyronie's genetic blood test, first one there. There's new diagnostics for erectile dysfunction. There's new mechanical therapies for erectile dysfunction. So there's quite a bit of new and innovative things that'll be happening, I would say, over the next 2 years. From a penile prosthesis standpoint, there's new completely new companies and availabilities there. There's new innovations within the companies that already exist. So it's really a pretty exciting time overall.
That's great. That's really, really exciting. I think innovation is always a good thing. And it's really great to hear that there's a lot of stuff, even as in someone like you, who obviously lives in this space, you find to be sort of really passionate and exciting going forward. So maybe in the last few minutes, what would you say should be some takeaways from our listeners? Things that you would want to impart on those listening to this, just, maybe about the annual meeting content, maybe even outside of that, some final messages for our listeners.
Well, I do think that, all subspecialties within AUA are important. I mean, these are all medical issues and things that people deal with. Certainly the sexual medicine side makes up a fairly large set of people's practices, whether general urologist, APP, or whatever the case, whether it's dealing with erectile dysfunction, Peyronie's disease, ejaculatory disorders, libido, things like that. It's something we all face. And so I think it's the Sexual Medicine Society and these meetings at AUA are absolutely relevant to people's practices. The big thing is it's really difficult to get some of this information on your own. If you just go out in general advertising, you won't know how to differentiate the fluff from the reality. And that's where meetings like AUA and these types of programs really help to dial in to what is legitimate science, what is legitimate medicine, particularly within the field of sexual medicine. So we hope the program we've set up will be interesting, will help to involve people, but most importantly, we want to get across these are the true messages that you should know, coming out of this type of a meeting.
Yeah, and I think it really goes back to one of the first comments you made, which is that in this space, there's a lot of information, but there's a lot of misinformation. And I think and if you were to go and just sort of be a casual person that searches for this, the takeaway messages you may get if you just go onto the internet or you do some casual reading may not be the evidence-based or the correct messages there. And so I think that as you alluded to, having the chance to really hear thought leaders and provide data, evidence, and again, opinions may not always be synchronous, but at least, it's a good dialogue based upon data and evidence. I think at least allows those that are attending to walk away with a better sense of the data, not necessarily maybe some of the promotional aspects of it. Landon, really big thanks. It's always good catching up with you. I know I hope to see you in about a week. I know the AUA itself is very busy and everyone's sort of running here and there. but do very much appreciate you taking some time to orient some of our listeners and really highlight some of the exciting events for SMSNA at AUA 2025.
Yeah, likewise, my pleasure, for sure.
To our listeners, thank you very much for your time. We look forward to seeing many of you in just about 8 to 10 days at the AUA 2025. And please register and take advantage of the Swap Card app in order for you both to identify events that would be interesting, but also to take advantage of a lot of the digital content that will be stored so that you can watch a lot of these activities asynchronously as well. Landon, thanks so much. I look forward to seeing you soon.
Likewise.